Welcome to the Gum Guru podcast. Thank you so much for joining us. I'm Jason Kong here with Dr. Macon Singletary, and the subject of this episode is tooth sensitivity. You have sensitive teeth, and I think this is something that Dr. Singletary, well, first, how are you doing, Dr. Singletary? What's new in your world?
Better than I deserve, and grandbabies.
Well, congratulations to you and the whole family. I know it's an exciting time for you all. As I anxiously got into, we were talking about tooth sensitivity, and I think this is something that we can all identify with on some degree, but let's start with the basics. What causes tooth sensitivity?
Well, that's it can be multifactorial, but if you start with the tooth and what's attached to, the tooth sits in a socket, and between the bone and the root of the tooth, there are capillaries and nerve fibers. So you got a source of sensation already around the teeth. And just as an aside, I don't think I've ever mentioned this, but with a normal set of teeth, you take out the wisdom teeth, you have 28 teeth, 32 with wisdom teeth. The surface area exposure to the cardiovascular system is the size of your hand. So that's the capillaries around it. But then in those capillaries are nerve fibers. So sensitivity can be the result of chewing, clenching, grinding, pressure on the tooth more than normal, and it gets transmitted to the neck of the tooth. That's one source. Another source is over time. Now, don't get me wrong, orthodontists do a great job, but when your teeth are jumbled up and you have the big tooth, small jaw syndrome, and they line the teeth out the way they should be, it's rare it's in the middle of the bony housing. And most of the time, orthodontic therapy is done in people who are not susceptible to gum disease. If you remember, there are 4 kinds of patients that I see. Good teeth, good gums. I rarely see them because maybe for gum grafts or implants. Soft teeth, good gums, they're susceptible to decay. Bad gums, good teeth, see them all the time unless they fire me. I'm the right arm of the dentist, but they see them all the time. And the bless your heart group is your soft teeth, bad gum group. You don't want to be in that group. But within that framework of the tooth sitting in gum tissue, bone, and the gum attaches around the neck of the tooth, there's 3 millimeters of gum attachment that protects the bone. And that space between the tooth and the gum, that the gum sort of overlaps the tooth, is 3 millimeters. And over time, toothbrush abrasion, food abrasion, clenching and grinding, if the attachment is thin, the biotype around the neck of the tooth is thin, you get the gum recedes. It detaches, and there may not be bone there. So the 3 things I look at when somebody comes in, they say, I have recession, I have sensitive teeth. The character of the gum, is it thick or thin? If it's thin and there's a prominent root and no bone, and generally it's post-ortho, the tooth is out of the bony housing. And so over time, you get what we call passive eruption, and the gum recedes. Active eruption is when the tooth comes into the mouth. The baby tooth is there, the adult tooth is a bud, and it develops and pushes the baby tooth out, and it's sort of timed perfectly. As soon as the root's formed, it's hitting the upper tooth, that active eruption stops. Then passive eruption occurs the rest of your life, and it's predicated upon the position of the tooth, clenching, habits. It can be medication you take, things that you experience day in, day out. And if it's thin gum, prominent root, no bone, you're going to have recession. Well, the enamel on the crown is pretty thick. It covers dentin. The cementum on the root's real thin. So cementum covers the dentin on the root. Well, cementum goes off with a couple of brushes of your toothbrush. Well, there's dentin. And dentin has little tubules in it that have nerve fibers in it. And those nerve fibers sense osmotic pressure changes, hot and cold, sweets. And that's where the sensitivity inside the tooth comes from, those tubules being exposed. And so, somebody says, well, I got sensitive teeth. And I get a lot of second opinions, or people that come in and they have sensitivity and they want to do gum grafts. And when I'm looking at whether a graft needs to be done or not, I'm looking at the character of the tissue. If it's thin and a prominent root and no bone, then maybe a graft can be done. But I always tell patients that sensitivity may not go away with covering the root with gum tissue. The only way, the really way to do it at home is fluoride. The fluoride in your toothpaste, there's three levels of defective fluoride. Level 1's toothpaste. It leaches in, leaches out. Level 2 is fluoride, is varnish. It's sort of cool technology. You coat it on, it cures into the enamel and the dentin. Level 3 is fluoride paste and trace. But that root being exposed, the fluoride plugs up those tubules. And so that contraction and expansion of fluid in the tubules stops. And so that sensitivity to the nerve goes away. So recession from toothbrush abrasion, just wear and tear over time, you can have healthy gum tissue. I mean, there's dystrophic gum disease and non-dystrophic, inflammatory, non-inflammatory. And you can have long teeth and have healthy gums. It's just you had the big tooth, small jaw syndrome.
And when it comes to sensitivity, a lot of times we see different products marketed towards sensitivity. Do those help at all, or is this really something that a professional needs to give you a professional diagnosis for?
If you have sensitive teeth, you consult your dentist or periodontist or dental professional that can sort of give you an idea. Now, there's sensitivity like the hot and cold, and it goes away pretty quick. The over-counter fluoride, any ADA-approved toothpaste has the appropriate amount of fluoride in it, and that you can get over the counter. There's, I won't name products, but you can look at the toothpaste. I mean, there's several lines out there, and some people think some toothpaste work better than others. And sodium fluoride, high concentration sodium fluoride toothpaste, stannous fluoride, sodium nitrate, but they all affect people differently. One toothpaste may work for you, but it won't work for me. So go out, look at the label, pick that toothpaste that you think it says for sensitive teeth, and see if it works. But yeah, ask your dental professional. There can be, as I said, there's the at-home treatment, then there's in-office treatment. And things can be done in office to coat the root surface and help with that sensitivity if it's extreme sensitivity. And if there is significant recession and there is propensity for more recession, gum grafting may be a factor too to help, but it's not necessarily going to be the answer to the problem. I always look at, will there be further recession if we don't do anything? And I address that. And they'll address the other issues too. But yeah, there's in-office treatment that can be done, and there are different levels of therapy that can be done for sensitive teeth, but it can be aggravating. Another factor, which I just mentioned, is when a dental exam is done, that the teeth enamel of the teeth, when it's being developed, they get developmental crazes, and they can cause sensitivity, and that can be significant if it's not pursued. The dentist may look at that and say, this could be a problem. This can turn into a crack, and to do a crown or do whatever is appropriate to eliminate that craze line is an in-office procedure that will help. And in my case, that craze line, which was not a crack, it was getting to be one. Put a crown on it, and I can eat on it now. But before, I woke up, I clenched during my sleep. I have a mandibular advancement device, and I think I clenched real hard, and I woke up the next day, I'm going, this is not normal. And it did not go away, and I couldn't bite on it normally. And so I diagnosed this all the time. The question I had was, is it really cracked? And but it was just a craze line. And putting a crown on it, I'm fine. So yeah, I mean, there are varying degrees of it. But if it's something that's specific on one tooth, get in and see your dentist, because it could be a structural problem. It doesn't necessarily mean that the root's exposed. There could be something else going on.
You gave us a few examples there with the craze line eventually developing into a crack. And when it comes to having sensitive teeth, if this is something that we maybe put off or just try to power through thinking that it'll eventually go away, what are some of the consequences here? If we do have a whole lot of recession, what are we looking at long term if this is not addressed?
So you do have to be concerned with dentin being softer than the enamel and can decay easier. So there can be softened tooth structure that's starting to deteriorate or decay. Decay is caused by bacteria. There's several levels of bacterial growth. the ones that cause gum disease don't necessarily produce an acid that causes decay. It's a different thing. The earlier bacterial growth are little round cells, and they're called strep mutans, and they produce an acid that decalcifies the tooth and also can stimulate dentin. So brushing the plaque off, number one, if you get good at it, may make the sensitivity go away. Number two, if there are nooks and crannies that you can't get to and the plaque continues to build up and you notice that sensitivity, it does cause decay and decalcify the tooth, and there the bacteria is starting to get into those little tubules and eventually gets into the nerve, and that's not good. Then that's the root canal thing. So, having it evaluated to see if there is decay, and addressing that. But, physically removing it, make sure there's not decay there. The way your teeth fit together, clenching and grinding can be a factor. Do you have sleep apnea? Because sleep apnea, people who have sleep apnea will clench subconsciously to open the airway. That can cause the teeth to be sensitive. So it's, again, if you've got sensitivity, there's a reason for it. And to have somebody look at it and say, okay, this is what's going on. And you can always get a second opinion, because sometimes sensitivity can be nebulous. It's sort of like temporal mandibular joint issues. It can get sort of crazy, but sensitivity is sort of the same way, and it may be as simple as a habit change. Could be identifying there's a clenching issue. A night guard needs to be made. It could be as simple as changing the toothpaste to a more potent toothpaste.
You've mentioned in previous programs your golf bag of tools and clubs that you can use to help treat your patients. I imagine with something like sensitivity that can have a number of different causes, that really comes in handy for you, where you can find out that cause and find a treatment option that fits best for the patient.
Exactly, and there are different clubs that you can pull out. The certain toothpaste. There are some that I recommend. There's prescription, and then there's look at the occlusal adjustment club, where you do a limited bite adjustment. Sometimes it's one tooth's being banged on, and you can adjust the bite. So there are different clubs that can be pulled out and used, and a matter of pulling out the right one at the right time. And some people come in and say, just take the tooth out, And I always tell them, unless I see something really that's infected, I'm saying, let's try this, because we aren't like sharks. We don't have another row that crops up afterwards. So.
If only we did. Well, tooth sensitivity is something, for those who experience it can be quite uncomfortable and something that can be a bit unrelenting. So what are our action steps for those who this is an issue for?
Being aware of what you may think is causing the sensitivity. And then just make sure you get good advice from your dentist. And if he says one thing and you're thinking, well, always get a second opinion.
Yeah. It can never hurt, and that applies certainly to our health, but it can extend to other areas as well. Well, we are out of time for today. Thank you so much for listening. You have been listening to The Gum Guru with Dr. Macon Singletary.
If you want to know more about how to keep your mouth healthy and your smile bright, or need an appointment with Dr. Singletary, check out their website at northraleighperio.com. If you have other questions you'd like to have answered on the Gum Guru podcast, send them to contact@northraleighperio.com.